Hi, everyone. This is Dolly Begum, MPP for Scarborough Southwest, and today we are here. I'm with family members and a special guest to talk about long-term care, but more specifically, tender care. As you have, many of you have reached out over the past few days, we have decided to have this urgent town hall. As many of you know, we do these town halls as a part of our New Normal series during the pandemic to talk about some serious issues going on and how we can address them in Scarborough. This is part of our series of many town halls, including ones that we have done in long-term care because this is not a new issue. However, today we have decided to host this urgent town hall because of what we're facing in tender care. As of today, the numbers have increased to 62 deaths in tender care living center. Across Scarborough, many other homes, we have faced countless deaths in long-term care homes. As the MPP for Scarborough Southwest, I have talked to many residents across across Scarborough. As the Deputy Whip for the Ontario NDP, we have come together and provided the Minister with many solutions for how we can fix this crisis as well. Today, I am very delighted to have a friend with me who has been doing some incredible work in long-term care. She needs no introduction. As many of you know, Dr. Vivian Stamatopoulos will be joining me this evening to talk about what's happening in tender care, but across the province as well. She is an associate teaching professor at Ontario Tech University whose research specializes in family caregiving. Over the course of the pandemic, Dr. Stamatopoulos has become a leading advocate for long-term care residents and their families, with a particular focus on the damages of prolonged visitation bans and other systemic issues plaguing the sector. To that end, she has also provided over 85 expert interviews, led many virtual events on emerging pandemic developments, worked with MPP Lisa Gretzky from the Ontario NDP to table Bill 203, as many of you know, which is more than a visitor act. And most recently, she's helped lead the Tender Care LTC or hashtag Tender Care LTC protest to demand military teams to be sent to assist in tender care. Dr. Vivian needs no introduction. She's an advocate for the residents of Scarborough. She has been doing incredible work supporting family members to raise their voice about what's happening in long-term care. Please welcome Dr. Vivian Stamatopoulos.
Thank you, Dolly. I really appreciate the time and really having this opportunity tonight to let the families share their concerns, because I think what has been really absent over the course of this pandemic is the experiences and the voices of the residents, often communicated through their loved ones, their essential family caregivers. And I think we are at a very pivotal time right now in the second wave of the pandemic. The outbreaks are just at an all-time high. We have over almost 2,800 seniors who have lost their lives in long-term care. So far that in the past week, the 7-day average of deaths has doubled, and that figure has tripled since the beginning of December. And I fear it's just going to get worse unless we have some immediate and swift action by our government, particularly Minister Fullerton, our long-term care minister. At this very moment, we have 1 out of every 3 long-term care homes in outbreak. We just had a long-term care staffer passed last night. And I think it's a really upsetting time for families. And I think it's really important that we really focus on what they need and what they are worried about, while also pushing for immediate crisis interventions, because it's not just tender care. We just heard about another home in the GTA in the Annex area with the highest number of cases, and that just exploded out of nowhere. And this is what we are seeing, these concentrated exploding outbreaks, mass casualty events, where these homes, the responsibility for these homes has been downloaded onto the local public health units. And while they may have been able to step in and provide that single-handed savior role, so to speak, in the first wave, they can't do that now. They are overburdened, the hospitals are overburdened. And we need to make sure that our government is actually instituting a provincial, standardized, and proactive, most importantly, proactive crisis response to not only tender care, but the many other homes that are experiencing these very devastating exploding outbreaks where dozens of staff are off at home sick, and who is in to replenish that workforce? We cannot keep relying on a reactionary response after the fact. We need to get into these homes at a critical time at the start of their outbreaks and help to prevent these mass casualty events, because as it stands right now, they will continue and they will get worse if we don't do anything.
Thank you, Dr. Vivian. I think and we're going to have a lot of family members join this evening to share their stories on the Zoom call, as well as to those of you who are joining live on YouTube, on Facebook, and on Twitter. Thank you so much for coming this evening and sharing your stories as well. Please make sure to comment, write to us. You can also, keep yourself anonymous if you'd like to. Just send us an email, and we'll try our best to make sure that we share those this evening as well. Before I get started and welcome some of the families in, I want to make sure that we set a few house rules. So making sure for those of the family members who are inviting in, we will have you speak for 2 to 3 minutes. For those who are not speaking, keep yourself muted. And for those of you who are joining on our lives, you can make sure that you comment as well as ask any questions to myself, Dr. Vivian. And if you have any questions for the minister, we will be writing to the minister right after we end this session tonight to share what we hear today, because we believe it is important to make sure that the minister knows all these stories and acts immediately. I have to first do something that I always do when I speak in the House, which is talking about who these individuals are in these homes. Yes, they're moms, dads, grandparents, but at the end of the day, these were Ontarians. These are the people who worked hard, who built this province, who went to war, who have worked all their lives, paid their dues, and they need a little bit of support. And one day all of us may end up in that place. Need a little bit of help with groceries. We may need support at home. We may need help with bathing, feeding. All of these are the care that these individuals need. And when we talk about this crisis within this crisis that we're facing in long-term care homes, it's important to recognize that it's not just COVID-19 that's been the problem. The neglect that our elders face in these homes are what has been one of the biggest cause for many deaths and much more of the illnesses and the downfall of many of the seniors in these homes. So I want to ask Maisha, who's helping me on this Zoom, to see if we could get some of the family members to come in here and share and highlight some of the stories that we're hearing from. And Dr. Vivian, if you have any specific stories that you heard while we have one of the family members join, if you'd like to share any of the stories that you want to highlight, because I know you were at the protest just the last week. Both of us were there, and we know some of the family members were devastated. Please feel free to do so. So Maisha, I'll let you bring someone.
Hi. So I will now admit. I'll admit the family members in one by one.
I believe we have Calvin who's joining me, and Calvin wrote to us sharing his story, and he's been very vocal as well regarding what's happening at Tender Care. Kelvin, if you'd like to unmute and tell us a little bit about what you have been seeing and who do you have at Tender Care, let us know. Hi, Kelvin. Thank you so much for joining us.
Yeah, actually, do you hear me? Okay. Well, actually, it's my mom who being tested positive on December the 16th, and but we did not know about her result until December 22nd when my sister called them to find out. So you can imagine it was 6 days after positive on December 16th, and so that is 6 days after being tested positive. So you can imagine within these 6 days, if the nursing stations, the staff, they don't know about that situations, the virus actually already being spread out, to so many people. That is the concern. The second one is when the time we find out it wasn't tender care reach out to my family, and it was my sister who called them to find out. So the communication is not being transparency, and I would say really terrible. The second thing is even my story went on live with CP24 on December 23rd. Next few days were really torture. We still not getting really updates that we require. We've been calling them, only can leave them voice message and try our luck if they have some time to return our call. We see some breakthrough or the turning point happening after Lovejoy General's temporary management agreement in place. We gradually see some improvement, but as we family, we set up a WhatsApp group, we communicate. Even a minute ago, we still find out family not able to find out their grandma or the resident, whether they being fed with water, with meals. That is really anxiety, and it should not happen at all.
I agree with you, Kelvin.
Go ahead, Dr. Lee.
No, I agree with you. Were you able to get into the home, Kelvin, at all to visit?
It should not happen at
all. Were you able, Kelvin, to get into the home and visit?
No, we can't.
No, I agree with you. Were you able to get into the home, Kelvin, at all to visit?
No, we can't.
Okay. Were you able, Kelvin, to get into the home and visit? I think we're hearing a repeat. It's like, I can hear myself talking again.
Yeah, it is some of the audio setup here.
We have also heard, Kelvin, and you actually had a really nice timeline of what's happening in terms of the domino effect that we saw, because there wasn't enough infection prevention and control measures taken early on. And was it your mom who was the first one, really one of the first ones who got COVID? Did you find that, or did you learn after that they have enough measures for IPAC, or are they doing much right now?
Well, I think after the takeover of Lovejoy General Hospital, they now following the guideline much better than before. So the recent update we received is today is the 4th consecutive days no new case being reported. So that is the positive side we can see going forward. And again, this temporary management is just only for 90 days. But what happened if, after these 90 days, the tender care or the behind the scenes like extended care resume the management, will things back to what it was? Because what we see is the training, the education for the existing staff may not be sufficient or enough.
And that's a real fear. We've heard this from many families where there has been a voluntary or mandatory management order, and the families are very scared when that order starts to reach its end. And some have actually petitioned to increase those orders because they do not have the faith in the facility to resume that care at that time.
Yeah. I think another thing is the fact that we could have prevented all of this. The highlight from this second wave, the crisis we're facing in second wave, is that we could have prevented all of this. Early in July, we heard report from many of the other homes where they found that 19% the spread could have been prevented in Scarborough just by removing from 4 people in one room to 2 people in one room. Just a simple measure as isolating individuals differently could have done a better job of saving so many lives. Kelvin, I want to thank you for joining us. Is there anything else you want to share? I also want to tell Maisha to see if another family that we have who's joining us to share their stories as well.
And in the meantime, yeah, Kelvin, please tell us if there's anything you would like maybe the Minister of Long-Term Care to know, or if you have any outstanding questions that you want answered.
Yeah, I really want the Minister of Long-Term Care come out and speak and meet up with all of the long-term care residents' family. What she been keeping repeating herself, not actually the reality. I think those are really beautiful statement to state. Yeah, we got all this aside out. We doing much better than the first wave. That is nonsense. If it really better than first wave, we should not have so many lives being lost. And what actually did they do in the last 9 months? And why just only today telling us the specialized care center just about to open? What happened in the last few months, right?
Yeah, the response today actually just from the ministry's, from the ministry was just extremely disappointing because they have said the same same lines that they do, but just hearing, we care about the families and we will make sure that we are doing everything in our power to prevent any deaths from happening it made me so furious, because the minister does have the power to act right now. The ball's on her court. She has the power to take action this very moment.
Yeah, I think we're all a little fed up with nice words, and we want action. We want immediate action. We know what the actionable items are. We've been very clear on what these are. They have been very clearly laid out by the long-term care commissioners and not 1 but 2 interim reports. So all we need to do is have our minister take action and implement these urgent recommendations. That's all we want.
Yeah. Thank you so much, Kelvin. Your time is so valuable, and I really appreciate you sharing your story.
You're welcome. Thank you.
We have another family member who wants to remain anonymous, but has another story that they want to share. So I want to hand over to you. Please do share what you're seeing with your loved one, and tell us what you would like to see from the minister happen right now. Go ahead. I'm going to ask you to unmute first, and then go ahead.
Hello, can you hear me?
Yes.
Hi. So, I don't want to repeat too much of what Calvin has said. It sounds like his story was fairly similar to mine. So I'm a granddaughter of, I had 2 loved ones at tender care. My grandmother, she passed away from COVID. So very similar to Calvin's case, it was a huge lack of communication from the home. We were told that we would be notified of swab results as soon as they got them. And with my grandma's case, I'd called for updates. I didn't receive any call about her being positive. I found out incidentally from the nurse that, oh, your grandma's positive. And with subsequent calls to that same unit, 3 East, I'd speak to different nurses every time. And every time the nurses there weren't even sure that my grandma was positive. They kept asking me how I knew. So it was really a confusing time. Like, the people that are caring for her there don't even know she's positive. How are they implementing the right, IPAC protocols and, donning PPE and whatnot, things of that nature. And with my grandma's case, she stayed in a room with 3 other residents the whole time. The whole time she was found to be positive. They made no mention about moving her to any units. Tender Care had said that they would open up the 4th and 5th floor to be COVID units. They said that in a newsletter on December 10. That never happened. From the last town hall that I had listened in on the 22nd, they had said that they were still waiting on the fire department to clear those floors to open them up as units. And at this point, I don't actually know what's happened. I've been taken off the mailing lists and newsletters since my grandma passed away on Christmas. So I feel like the nurse and the staff there, they're stretched so thin. So it's good to hear if Northbrook General stepping in for the management side of things has improved the situation. But I do fear for what's going to happen, when that contract runs out. During those 10 days that my grandma was suffering from COVID, the nurses there, they were in a rush. They could only give me quick updates. They didn't even have the time to properly confirm patient identifiers before giving me medical updates. So one situation, they went as far as to tell me that my grandma had hypoglycemia, low blood sugar, that she was put on IV fluids. They had given her subcutaneous dextrose. None of that proved to be true. That was confirmed by another nurse afterwards. So those were incorrect medical updates that made it a very confusing and scary time for family. Another update was that, one of the nurses told me that my grandma was having trouble refusing to eat, refusing to drink. And then the next day I received a call from the dietitian at Dental Care saying that the nurse told her that my grandma was having trouble swallowing. So those are two very different things, and that I think had a huge impact on the care that she received downstream. So I'm just giving you my account. I don't have any way of making sense of it. I don't have any solutions. I just want the home to get the help they deserve and need.
Yeah. And I don't think you're alone. I think there are quite a few others who have reached out as well, where the communication, there's so many gaps in that communication. Some haven't heard back. And the fact that, your grandma was in a room with others after testing positive and you didn't even hear from them for days. And then her condition said, and I mean, that speaks volume to the neglect we see in many of these homes. Dr. Vivian, did you want to add?
Oh yeah, sure I do. What really upsets me about hearing that information is that in relation to these ward rooms, which is one of the biggest problems in terms of the rising numbers in these larger, older facilities, is that design standard was banned in 1998. Yet, and keep in mind, all long-term care homes were told they had to upgrade their facilities to the newer design standards. So the fact that 40% of our Ontarian long-term care homes don't meet the current design standards tells you that it's not only, this is, the fault is to blame on both sides here. The government for not making sure that these homes upgraded, subsequent governments, not just the Ford government, but also that these homes, because we know that they have money is not an issue. That money was seemingly diverted instead, or apparently more worthy in shareholder dividends and executive compensation, instead of actually upgrading these actual ward rooms and getting rid of them and making them safer, because they knew every year these facilities, these older facilities, had higher rates of seasonal flu and other respiratory illnesses. So this was not unexpected. This was to be expected, if not predicted. And I'm just very angry for these families that this situation is still unfolding, and that the surge capacity facility that apparently is supposed to be have opened with 30 spots is supposed to be sufficient for all of the GTHA. I don't think that's going to work. I don't even think that 30 bed facility adjacent to North York General Hospital is going to be sufficient for the tender care residents alone, let alone all of the GTHA. So
yeah,
there's some problems.
We have also, and Dr. Viv, I'm sure you know this very well, there is the residents' Bill of Rights.
Oh yeah, I know it very well.
And then a lot of family members and family councils across the province have been fighting for family members to have a Bill of Rights as well, so they can fight for their loved ones. And what happened to you, with your grandma is just devastating, because as soon as she passed, instead of finding out what happened to her, you've been just dropped of all of the communication, and there it just
Right. So exactly. Even the morning when they gave us the call of the bad news, like Christmas morning, it was very easy for them to deliver that. I know they were sad about it, and of course that makes sense. But even on that phone call, it was a very rushed call. You could tell that the nurse on the line needed to get back to the other residents that were still there on that floor and still fighting. So that's December 25th. That's with North York General there on site. and it still sounds like they're short-staffed. And this like nightmare doesn't end. So last Thursday, 31st, we needed to get the health card back to do proper, documentation, to cancel OHIP, cancel CRA, whatever. The home was still sounding like they needed more help. Calling the nursing station, no one answered. Calling the social worker, Peggy, no one answered. Finally, we got through to the nurse and say, hey, we just need you to run downstairs, give us the health card. And she tells us, I need 2 hours. Give me 2 hours and I'll bring it downstairs, down 3 floors. Like, I don't know how to make of that. Like, make of that what you will, but they need help, and I don't think they're in a position to ask. We need to intervene.
Yeah. And the amount of staff that have caught COVID also goes to show how they're risking their lives every single day to do the job.
For sure.
I think what is the most disrespectful thing out of all of this is the minister claiming that everything was stable, especially during that time when your grandmother and many others passed in that week, for example. For her to come on live, on camera, on TV and say everything was stable was disgusting. People deserve so much better than that.
Yeah, and even speaking to the MPP of this riding, I mean, he said that he has been in touch with the minister, Marlee, and that from his end, that they're saying that they've thrown every tool at this necessary.
Oh, have they?
His words. So if that's what they think, I can't argue with that.
I'm sorry you've had that experience. I mean, you have to do better by these families. I'm almost scared to hear what the next family is going to tell us. I mean,
Thank you so much for sharing your story. We have PJ Kwong with us as well, who's going to share her story. PJ, do you want to turn on your camera and unmute and tell us about your loved one in tender care?
I hope we didn't lose her.
No,
take your time. Take your time. Okay.
Can you hear me?
Yes.
Great. Aisha's going to turn my camera on because I had it off. It was my fault. Can you hear me now?
Yep.
Wonderful. I want to say, first of all, apparently the minister needs a dictionary to understand what the word stable means, unless the minister thinks that stable actually refers to the number of people dying and continuing to be ill. I am absolutely shocked by that, but in other ways, not shocked. Minister Begum and Dr. Stamatopoulos, thank you so much for doing this today. This is so very important. My family is the family who was maybe the second story on the front page of the Star back in March. My ex-husband Patrick and I decided, with my then 93-year-old mother-in-law, who's now 94, God bless her, that if things went the way that they were starting to go in Washington State with old age homes, that we were going to find a way to get her out. I live in a very modest home, and we were going to still figure out how it was going to work. My ex-husband and my ex-mother-in-law have moved in on March 19th. Now, what is so interesting about this story is the fact that Tender Care fought me on every step of the way. For those people who know me, they knew that I was going to win this battle. Tender Care apparently thought that I wouldn't. The first thing that they did was that they didn't notify us directly that there had been an outbreak. The first article that ended up in the Toronto Star was about a worker in the kitchen who had contracted COVID, and as a result, the residents went on lockdown. So that started sort of this whole ball rolling. I had numerous conversations with everybody from the executive director to the director of care and the director of nursing, along with several nurses on the floor, and said that my mother-in-law would be coming out. How were we going to do this? What they did was they threw Toronto Public Health under the bus and said that it was a decision of Toronto Public Health that we were unable to remove her from the home. And at that time, so we're talking about maybe March 11th, 12th, she came out on March 19th. And at that time, you couldn't get a hold of anybody in Toronto Public Health. I still have the direct message on Twitter of trying to get somebody at Toronto Public Health to at least look at her case. I asked several times of the staff to please, in their twice daily meeting, which I happen to know from another nursing friend, I asked them to please bring it up to Toronto Public Health that we were willing to assume all responsibility. If they wanted the money for her on a monthly basis, we would continue to pay them to hold that bed, whatever it took, but she was coming out. Every time I turned around, there was somebody else who was being particularly obnoxious with me. And although my tone was firm, I never lost my temper. I wanted to, but I never did. And I spoke to them directly about what is wrong with this picture. My mother-in-law does not have COVID. We don't have COVID. We are now all going to be at home. I'm self-employed. My ex-husband is now retired. What is the problem with trying to care for her in the loving arms of her family, a situation that we weren't able to do when she first entered into the residence? We're also lucky because she has no cognitive dysfunction. So as a result of that, we were going to make it work, and we have made it work. So on the Saturday of that week, March 14th, Brendan Kennedy of the Toronto Star wrote about the outbreak, which was only one case at that time, at Tender Care. I contacted him via Twitter and said, I found it very interesting that the home was not willing to release my mother-in-law. We'd sign anything to our care. He put me on to a colleague of his who started the interview process, Donovan, and his last name has just gone out of my head because I'm nervous. But anyway, you can look up the story. And I said to him, told him the whole story, told him that they were not willing to sort of do this and that they kept trying to bring Toronto Public Health in and they weren't going to talk about it, yak. And he went away, did some more research and came back to me. The thing that is most shocking to me about all of this is that the home then tried to lie. They tried to say that my ex-husband, who had power of attorney, that he was completely fine with my mother-in-law being in that home. And she was in one of those wardrooms. She would have been death number 63, I am convinced, if I hadn't been able to do what I did. And I really believe that part of the story is because the Toronto Star put my mother-in-law and our story on the front page March 19th, which coincided with the day, they told us the day before, the day that she would be released. Now, when we move forward a little bit more, here's how helpful Tender Care was. They wouldn't give us the name of the doctor, so I couldn't easily get her prescriptions renewed. Fortunately, I have the most amazing pharmacist who helped me. My family doctor took her on as a patient. We all know how difficult it is to find a family doctor, but my family doctor, recognizing that this was an extraordinary situation, took on my mother-in-law. The home didn't help me. When we tried to figure out other kinds of care kinds of things, nobody would give us anything. Not only that, you're going to find this hilarious. It was 3 weeks ago. She's been with us 9 months, 9.5 months now. 3 weeks ago, it was when the executive director called to see how is she doing.
Can I ask you, and I want to put this out to everyone who talks today, I want to know about the doctors, and because I'm not hearing anything from physicians, and I have physician friends who have gone in an emergency basis into these homes, and they're very critical of the lack of medical presence in these homes. And I want to hear if everyone has had a similar experience in terms of, I hear you talking to the nurse on the floor or potentially a PSW. I think it's usually a nurse who does these phone calls. Where are the physicians? Where are they? I would love to know that. I'd love to hear people's experiences there.
Well, I can't even tell you where we got given a 2-week prescription. By the way, the rule at the time, I don't know if it's the same, was that a resident was allowed to be out of the home for 21 days before their bed would be given away. It was about 10 days after she arrived at my home that we got a phone call saying, come and pick up her stuff. It's all in boxes. So she didn't even have the option. She's perfectly well where she is here. We love having her here. We consider ourselves to be among the lucky ones. The people, mostly women on the floors who were doing the hard work, the grunt work, I cannot say enough good things about them. Their job is impossible. Who I have the quarrel with is the provincial government. Who I have the quarrel with is the for-profit long-term care companies who are not providing adequate resources. They would rather have people being paid part-time wages so that they don't have to give benefits. They This is on them, not on the women and men who are trying to provide the care the best way that they know how. It is the companies who oversee this. It is our government who oversees this. And
I agree.
hilariously, they got so annoyed with me that when they saw my number come up on the nurse's station, they stopped answering the call. I cottoned onto it about 3 calls in, and I changed it for my daughter's phone. And then I changed it for my ex-husband's phone and my home phone. Funny, they were able to answer those calls.
I'm
Anyway,
sorry.
that's my story. I am heartbroken for all of the families who have suffered. It brings me to tears every time I look at it. And I am just so very grateful to be in the situation that I am, surrounded by the amazing professionals that I have been surrounded by, who have helped us negotiate all of this and make sure that she has the medication that she needs and the care that she needs. But it just shouldn't be like this.
It shouldn't. It really shouldn't. It shouldn't take us the front page of a newspaper, or doing these lives, for example, or any of this. It shouldn't take all of this. It shouldn't take the fight that you had to fight for a ministry to understand what their job is. And they clearly have not understand what their job is yet. There is staffing hiring. We have asked for many months.
Was I doing a bad thing? Taking, as I explained to them, the person who was in head.
You're helping them.
I said, I'm taking out somebody that you don't have to give medication to, that you don't have to feed, that you don't have to do anything with. I'm going to look after her, and I'm going to assume all responsibility. And believe me, they made us sign a waiver. And I said we would. I said, all I want is her. If I have to come in and walk her out myself, I will. But the rules were you didn't want outsiders. So let's negotiate this. Let's figure out how I'm going to get my loved one out. But I'm helping you. I'm taking a body away that you don't have to look after anymore. Where is the bad part of that? And she was in isolation when we brought her home, just to make sure. And we've been safe every day since. But again, my blood's boiling.
You did the right thing. You did them a favor. You helped out. So I just don't understand why it was such a battle to ease their burden. I'm sorry you went through that. I don't know if anyone else that's on this call or will be joining actually had that experience, or whether all their loved ones are still in the facility.
I have Reed Zhao here as well. Thank you, PJ. I want to ask Reed your experience as well, because I know staffing has been a big problem, and you've been dealing with a huge battle yourself. If you want to turn on your camera, please feel free to. I'm going to ask you to unmute and share your story next. Go ahead, Reed.
Hi, Dolly. Yeah, thanks for doing this for us. The bad news is my grandma just passed away this morning.
Oh my God.
At Rural Hospital.
I'm so sorry.
Yeah. So it's so troubling to have the last communication with my grandma. She was crying in the phone, telling me they didn't give me water. I like hot water. I cannot drink cold water. I had the last phone call with her like on last week, Thursday, I believe. She was crying in the phone. She said, they didn't give me water. I cannot take cold water. She kept saying that.
Oh, I'm so sorry. I'm so sorry.
So, yeah, we were informed originally on 18th of December. And the day before she was transferred to that isolation area, I did call her. We installed internet and landline for her room. She was loud and clear on the phone, and she has a sound mind, even joked with me. But 2 days after she was transferred to that part of the building, we lost all contacts. Until I sent in an iPhone in auto dialing mode, in auto answering mode, I managed to call her like the following Wednesday. She was so weak, she could barely speak. I could barely hear her. I didn't know what happened in that 3 days when she was transferred out of her room to that isolation area of the building.
Did any of your family try to get in and to visit?
We're not allowed. We tried. If we knew this earlier, we would do whatever we can to take her out. because my grandma, she was such a healthy person. Like she was 96, but she kind of manages to go to bathroom and eat food herself. Even the service worker described to me, like before the pandemic, she's one of the most active member in the long-term care home.
And you tried to help your grandma try and wrote something and explain to them.
Yeah, as soon as I know she was moved to the isolation area of the building and lost the contact with her, I was so worried. I sent out mass emails to medias, to MPPs, to whoever I think may help us. I just try everything I can to help. But until I see the news report next week, I came to realize that they were lacking basic health care, like basic care such as food, drink. Because I have heard from one person that had COVID and recovered, that it was so difficult to swallow water when you have COVID. So I don't know, like, how those old people were fed with water in there. I don't know.
And I just want to thank you, Reed, for and I'm so sorry for your grandma. My heart is with you, your family members, and to all of the others who have lost loved ones in tender care. I know there's others who tried to get a hold of staff to make sure that their loved ones were fed, because they knew that this was one of the symptoms of COVID.
I believe conditions are improving this week. Since the new year, I believe conditions are improving, but we deserve to know how they were treated in the week of December 18th and the week after.
Yeah.
I think as family, we deserve to know how they were treated. What was the staff number there? How many people per shift, per floor were assigned to those sick and old people? So far, there is no number. I don't believe the talks like we've been doing our best or we have taken care of your grandmother. I don't believe that, because we don't see Red Cross in there. They are not doing their best.
Yeah.
The province, the ministry, they're not doing their best. We don't see Red Cross there. They certainly needed it, but we never know.
We hear this all the time. This is such a common concern, especially in tender care, that the communication, the lack of communication, not enough people being able to answer the phones. That's not a good indication that everything is stable if there's nobody there to answer the phones. So of course, family would be feeling this way. That would be my first concern. There's no doubt about it. I think that's a very logical assumption to make when you don't have staff to actually give family updates, let alone let the family inside to help resume that essential care that family do. So locking out family at that start of the outbreak was, from what I'm hearing from families, that's what happened. That was a big mistake.
And Dr. Vivian, I think we talked about this before, actually, was in 2019, and we invited the minister to join that town hall as well. We had a town hall similar to this, where and it was in person, and we had family members tell us how in one of the homes, another home in Scarborough, they have about 52 residents per one staff.
Just unacceptable.
And we were trying to calculate how much time would one resident get if one staff has to run around. And now imagine if someone needs some urgent care. I mean, and this is 2019, I'm telling you. The fact that we're in 2021 right now and we're hearing stories like this,
yeah.
I don't know how the minister sleeps at night.
Yeah, I don't know how these people, the management of extended care, can sleep at night.
I don't blame you for feeling
at the
like
end
that.
of this, somebody need to take responsibility and accountability.
I think the sad part is that, having one nurse for 2 units is not out of the norm. The problem with this sector is that there are no staffing standards. There is no care standard, which is why you see such a widespread neglect, quite frankly, across this sector. And it's just unacceptable. Nobody would want their family member to be in this situation. And COVID did not cause the conditions within these homes that we're seeing. You hear this all the time. It just put the spotlight onto what's happening, unfortunately. And this is the opportunity to actually change this system. This is systemic problems across the sector. But again, there are some homes. Traditionally, what we're seeing is the for-profit large chain ownership homes that are the worst offenders and have been failing this COVID test, so to speak, wave 1 and now again in wave 2. And there seems to be zero penalties for failing these families. I mean, we have a ministry inspector that was in tender care in mid-December, documenting widespread infection prevention and control violations that absolutely contributed, if not caused, the outbreak at hand, if not led to this mass casualty of over 60 residents right now. This was preventable. This was preventable. And I think that the lack of acknowledgement of that simple fact by our minister speaks volumes as to her ability to hold these homes accountable publicly. Because I think anybody with a conscience, quite frankly, would be able to say that this is wrong and we need to hold this home accountable because these deaths should not have happened. And these families deserve a modicum of justice. And right now, they're not even getting a basic appreciation of what they went through. The pain, the fact that families were losing their loved ones on Christmas and nothing, no public immediate press conference, no emergency press conference from our elected officials. When we have a mass casualty event, we have the equivalent of a downed plane, and we don't hear anything from our officials is a big problem. Sorry, I'm getting a little angry there, but I feel very badly for these families.
I feel you. Reed, I want to thank you. I know that that frustration is felt by so many of you who have joined, and I want to thank you. And I will get to the questions that you're sending us, and we're getting so many questions, and I really appreciate all of you and the stories that you're sharing. I do want to take a moment to also highlight the precarious nature of the workers as well. These workers go from home to home, and now we have tender care, for example. We have other homes that are going through agencies to find workers, because for many years we have neglected in hiring enough staff, enough full-time staff, making sure that they're respected and they're recognized for the difficult work that they do.
Listen, there's a reason why 50% of personal support workers leave healthcare altogether within 5 years, right? 43% leave the sector altogether because of this working short that is the feature, not a characteristic of this sector. It's the feature across this sector, that these homes are consistently understaffed, although we don't have any staffing ratios in place, which we need. And this is something that our Prime Minister should be helping with. And that's something I'll talk about a little bit later. But there's a reason why there's a revolving door in this sector, because you put these women in a position where they're designed to fail. They are thrown in charge of, it's always women in charge of, not always, sorry, but the vast majority are women, also women of color, and many of which are new to Canada. And unfortunately, we have seen that relying or abusing, quite frankly, both racialized and gendered workforces is a feature of many workforces. And this is a larger globalization feature. And unfortunately, we have seen this happen in long-term care, and that's exactly what happened. We had a sector that was 20 years ago, primarily nurses, hence the term nursing homes. And then when you see the privatization start to increase over the last 20 years, thanks Mike Harris, Order of Ontario, then you see the staffing mix.
By the way, and I'm going to say it, I apologize for my language, but that was complete bullshit. You do not award somebody who single-handedly destroyed the long-term care sector, who chopped off our province, handed on a platter to private shareholders, and you do not award them for it. For so many deaths, the former premier is responsible. That is just not right.
Yeah, there's a public outcry for a reason, for a very good reason.
Yeah. Thousands of people. Sparky, I'm so sorry. I know you've been waiting for long. Reed, thank you so much.
Thank you, Vivian.
for you,
Thank
and
you.
thank you for joining me. Sparky, please go ahead and share. I know we're running out of time, but I will get to the questions. I promise you guys.
Unable to start. Hello.
There you are. Yep.
Hi. I'm not sure why I can't get the camera on or off, but that's okay.
That's okay.
Well,
go,
we can
go
hear
ahead.
you.
So where do we go from here?
That's the question.
So what's the action? What's the plans?
What would you like to see?
I mean, we're talking about a system that's been broken for decades. You know, as an advocate for years, it's only been worsening. The legislation is fast tracking bills with the objective goal of keeping people out. What you can't see, you can't report. What you can't get in, you can't go to police stations and report. This isn't just about government. This is about the corruption that is universal in Ministry of Health not doing its job, that was created back in the day after thousands and thousands of reports. You have pockets being lined from the government to the Ministry of the Health to the police departments, et cetera, that I personally believe what it's going to take is that the Canadians need to rise up. They need to speak up. They need to show up. And it is only us as a society that can bring about the change. We write letters. We show up at police stations. We call the ministry. We talk to our MPs. We attend the rallies, et cetera, This is a system that, you know, sadly, and I keep repeating it, that there's no profit to be made in the living. It's profit to be made off the deaths and the back of our sick, our suffering, our dying, and our vulnerable. And we as people need to be rising up, standing up, and serving and protecting our people. And it's great to see that, you know, more technology is coming to light, that people can Zoom, we can have these meetings, we can make alliances with one another. But what I'd like to see have happen is these places, we have laws in Canada that need to be adhered to. We have government and people who are not adhering. Who do we turn to when the laws are being broken by those who are the law enforcers?
Thank you, Sparky. I think you just highlighted some of the critical points that we're facing in long-term care, which is, well, number one, we should have a government that's protecting residents and not the homes. What we saw with Bill 218, and every time I think about the legislations that were passed during COVID-19, it just boils my blood, because what it did was it actually helps managements, big CEOs and shareholders from getting away with the neglect that they have and the abuse they have committed throughout the past months. I also want to be able to share that we did ask for certain things, which is making sure that there was unannounced inspections in these homes. One of our primary ask is to have at least one inspector for each of the homes, and making sure that they are unannounced. You cannot have inspections that people know about. That just defies the purpose of inspections. So I want to thank Sparky Johnson for joining and sharing your story. I also have two other special guests here with me. One is my colleague and friend from Windsor, and she's the MPP for Windsor, Lisa Gretzky, who will be sharing with us about the bill that she put forward. Lisa, go ahead, turn on, you got your camera on, and I'm going to ask you to unmute so you can tell us about your bill.
Thank you, Dolly. Can you hear me? Thank you. I just want to start by saying to Reed that I am incredibly sorry to hear of the passing of your grandma. I know this has been a difficult time during the pandemic. I cannot imagine what it would be like not having that communication with her and then finding out that she has passed. That is, I don't know how you could, nothing I can say can make that better. So Dolly asked me to, or invited me to speak today specifically around the restrictions for the family caregivers. So in the summer, I had tabled a bill, Bill 203, the More Than a Visitor Act. And then in September, we debated the bill in the legislature, September 24th. That bill passed with all party support. It was unanimous, which means that every Conservative member that was there to vote voted in support of the bill. And so just to highlight some of the bill, and I want to thank Dr. Viv for her work with that as well. That's how Dr. Vivian and I met each other, is working on that bill. And I just want to put out there that we oftentimes hear folks refer to Dr. Viv as an advocate. She is a fierce advocate. She's also an expert. There's a reason why there's a doctor in front of her name. So with Bill 203, the More Than a Visitor Act, that came to be because I started through my role as the party's community and social services critic, started hearing from families in my riding who have adult children with developmental disabilities who are living in group homes. And those families were starting to be, their loved one that's in the group home was being denied access to their family members, to their caregivers. And then I started hearing from people across the province who had the same issue. And then it became within long-term care and retirement homes. And then I was hearing from people who have loved ones in hospital who are being denied access to those family members and in hospice and in many, many different congregate care settings. And it became very clear during the first wave of COVID-19, it became very clear to everyone except for the government, I should say, that there are very negative impacts to denying residents in congregate care access to their essential caregivers, their families. So the government was labeling all kinds of people as essential caregivers. They were talking about essential visitors, I should say. So, if somebody had to come in and do food deliveries to a home, or they needed some sort of mechanical, a plumber or an electrician or somebody to come in and do work on the home, they were being considered essential. But these families, or chosen families, because for some residents, it's not their biological family, it is chosen family. The government was totally disregarding, as were all of these different congregate care settings, the value to the residents to have those people come in and be able to see them and provide support. So there have been numerous experts, Dr. Viv included, who have come forward. We have the Registered Nurses Association of Ontario. There have been numerous doctors from different sectors of healthcare who have come forward. And there have been numerous studies and recommendations that have come forward for the government. It's been laid out for them, not just by me through my bill, but through numerous experts out there, how these essential family caregivers can be integrated into these congregate care settings, how it can be done safely. And for me, a big piece of that is when we're talking about a home like Tender Care and the company that owns them. When we're talking about homes like down here, the Village at St. Clair, where we have a horrific outbreak here, or Berkshire, which is Dr. Viv mentioned a worker that passed away from COVID-19. That was a worker from my riding who works in a home in my riding who passed away, Sheila, who passed away after 30 years of providing care to others. And these are for-profit companies that are not providing the appropriate staffing. So there's not enough staff. They're not compensating the staff fairly, and they don't value the workers that are in there. As Dr. Viv had talked about, we knew there were issues before. Unifor, a big union, represents a lot of these workers. I think it was well over a year ago, among many efforts to raise issues, did a 6-minute challenge where they talked about how in these homes, many times the workers have 6 minutes to get your loved one out of bed in the morning, get them toileted, get them bathed, and get them fed and get them their medications. But so anyways, I was hearing from a lot of families across the province and got to know a lot of people. And it became very clear that COVID-19 is not an excuse to be keeping these essential caregivers out of these homes. We found that the residents are being isolated from their families. They have cognitive decline. They have physical decline. They have mental and emotional decline. And for many people, they were beginning to summarize or come to the conclusion that the reason the homes were locking the caregivers out, in the beginning, there was a lot of uncertainty, so it was understandable for many people. But as we went through the first wave, and it was shown that with the proper PPE, that these for-profit corporations should be providing, not just to the staff, but they should be providing it to these essential caregivers. They could provide the training, and that should be at their cost. That should not be at our cost. That should not be the government paying for that. These for-profit homes should be paying it. They make a lot of money. So it became fairly clear to the families and the residents that the reason these homes were locking out visitors, these essential family caregivers, was because you're the whistleblowers. Staff are terrified to come forward and talk publicly about what is going on in the homes, and that they need support. And so it's up to the families. And that is why I had tabled the More Than a Visitor Act, to ensure that a strategy is put forward, a caregiver strategy, a legislated. So not just the guidelines like we're seeing now, because the guidelines state, and I just talked to the Minister of Long-Term Care a couple of weeks ago about the one home village at St. Clair here. And she told me, I told her families are being locked out, and she told me that's not allowed. They're allowed one visitor, essential visitor during an outbreak. That wasn't happening. That's not what the families were telling me. But the reality is these are guidelines. These are guidelines, and the homes and the different sectors in congregate care are interpreting them any way they want to interpret them. They are making the rules. It's not the government, and the government is certainly not enforcing them. So it's very clear that we need a legislated answer to this. So there is no room for interpretation, that there is consistency across every long-term care home, retirement home, group home, you name it, that everything is consistent, and that there are repercussions when those rules and that law is not followed. And the biggest two pieces, and then I'll turn it back over to Dolly. We do have other legislation that we have tabled our party, and I think Dolly's going to talk about those. But the two big pieces about this bill is that as the strategy is being developed, it's not up to the government to develop it. We want the family members, we want the residents, we want the workers, and we want the healthcare experts at the table being the ones that develop the strategy that the government then has to implement and enforce, and all of these homes have to follow. And the second piece of that is a staffing strategy. So to ensure that every single one of these congregate care settings, regardless of what sector it's from, every single one of these facilities, every one of these sectors has the appropriate staffing levels to provide that hands-on care that our loved ones need and deserve. And this is really, again, I know Dolly will talk about another bill that my colleague Teresa Armstrong had tabled that is also around staffing, legislating care standards and staffing levels in long-term care. So we have two pieces of legislation to try and get this government to do the right thing. My legislation is sitting in committee. Like I said, it had all party support in September.
They can legislate right now. They can
absolutely,
right now.
Absolutely.
The
government has a majority. They have a majority government, and they control the committees. They could have called this bill by now and got it passed, got it back in the House, and got it passed and made legislation. They could have passed this before they rose the House, days earlier than we were supposed to. They could call us back right now, which is what they should be doing. When you look at what is going on in long-term care homes across this province, none of us should be sitting here in our ridings. I'm here in Windsor having this conversation. We should be in the legislature. We could be there tomorrow to pass emergency legislation. The government has done it to protect the long-term care companies that are making money. They rush through that to put an iron ring around those profitable companies and their shareholders. They could call us back and rush through legislation in order to ensure that the residents in these long-term care homes are being protected, that they have everything that they need to be safe, that families have that meaningful, consistent interaction with their family members, not just phone calls or calls over Zoom, but in-person calls, that there's the PPE that's needed for the staff, the residents, and their essential caregivers in place. The government could do that tomorrow. They could have done it last week. They could have done it 3.5 months ago when I tabled the legislation.
Thank you so much, Lisa. I really
appreciate
it. I have another guest, and I have a lot of questions that we're going to get to as well. And I appreciate all your patience. And from what Lisa was talking about, the staffing, and for those of you who are concerned about the staffing and how we can hire staffing, and I know some of you are worried about that as well, we can actually do that. Quebec has done it, British Columbia has done it, Alberta has done it. Alberta, in fact, actually had a mass training strategy across the province. Quebec had, I believe, 10,000 staff they hired. British Columbia hired 7,000. We can do this right now, and we have called on what Lisa was referring to. We have called on the government to hire 10,000 staff, and that's something that they could do. The other one that I want to mention is Bill 13, which is the Time to Care Act. And that's by Teresa Armstrong, who has introduced the Time to Care Act. And that's the standard of care for each resident. So making sure that individual residents have enough care per resident, so that we don't have one caregiver running around the entire building trying to make sure that people are fed and bathed and all those things. Dr. Viv, I know you wanted to comment, and then I will go to Judith from Thunder Bay as well.
Well, I want to point out that when me and Lisa were working on that bill, which was tabled, I believe, in July, correct me if I'm wrong, Lisa, right? I think it was July 18th, around there. That was 6 months ago. And that was a very overt indication to the government that they needed to engage in a staffing blitz. So they were hearing these calls from at least us for at least 6 months. And the Time to Care Act, again, had a separate call for, you would obviously need to do a staffing blitz in order to get up to the care standard, because we know we have the data. And furthermore, even if the government wanted to fund it all, which they wouldn't have to, but even if they wanted to, we know how much it would cost. It would cost $1.6 billion. We have CCPA estimates. It will require a 51% increase in the total number of caregiving hours currently at play. So even if the government wanted to, they're sitting on $12 billion. They have the money. They could immediately increase this standard of care right now. But even in our province, because we have such a high level of privatized homes, all you have to do is pass the Time to Care Act, and then it will place the onus on the homes to staff up, where the onus should have been there anyway. So from the get-go. So this isn't even going to be a large capital investment from the province. It doesn't have to be if you pass the legislation, which is before you. Why are they not passing the legislation?
Well, the reason that we're actually calling the government to bring the House back is so they could pass these legislations immediately. We're seeing government members go on holidays. They went to the Caribbean, so we don't know where the Minister of Long-Term Care is. And I also want to say, you don't have to go outside of the country to be completely out of touch with what's happening in the province. We are seeing with the Minister of Long-Term Care, who's still in this province, but being very neglectful of what her duties are. And that is equivalent as going to the Caribbean. You might as well, if you are completely out of touch with the reality of these homes. You can pass Bill 13, you can pass Lisa's bill right now and make sure that people have the mandatory hours of care. Lisa, did you want to say something for 30 seconds? I have Judith on the line who's going to go next.
Just one point that I want to make just to wrap up as we talk about the seniors that are in long-term care. Dr. Viv has said many times that we see ageism based on the care that these seniors are receiving, but we also have adults, younger adults with disabilities, those that have traumatic brain injuries or spinal cord injuries or developmental disabilities because there isn't supportive housing for them. So we also see ableism within that this government is perpetrating or continuing to allow to happen.
You're absolutely right. Thank you so much. I know, Kaylee, if you're watching, you're an example of a role model who's been fighting that fight as well for people who have been suffering in homes like Midland Garden, for example. Another one that's for-profit, where someone young as 30 years old almost is going through the struggle and trying to fight for their rights. Judith Monteith-Farrell is next. She is the MPP for Thunder Bay Atikokan. And Judith is also fighting in her area with the crisis that they're facing in long-term care. Judith, go ahead.
Hi, can you hear me? Great. All right. Since November 17th, we've had a very traumatic kind of outbreak here in Thunder Bay at a privatized home, Southbridge, Roseview Manor. And we've been reaching out to the ministry, to anyone who will listen. And and talking to families. And what really strikes me is the stories that I've heard from your writing, Dolly, and across this province are the same. And it is the lack of communication, the lack of certified health professionals that have the ability to provide medications and medical oversight to patients. Families are frustrated, and they have almost like a formula of sending out these newsletters, having town halls by Zoom. But a lot of, elderly people who have elderly parents that isn't a way they communicate. And overall, we hear this lack of detail about what's happening to my family member. And the people that are going into the home, because they are allowing only people who actually provide care. So it's this whole thing. If you're not feeding or bathing the family member, this is the new policy they have. And if you don't have a very current COVID test, et cetera, they're not letting them in. They had large numbers of staff infected very quickly. They had large numbers of residents infected, and we have 19 deaths. And and lately they've sent in apparently infection control experts, but the home refused help from the Red Cross, and because they said they had enough PSWs, or they were fully staffed up with temporary workers when their staff was off. And the families are incredulous. They know, and I'm talking to the union as well, and staff are working short. And with the increased protocols, with the, so when they told me, I recently had a meeting with a local health integration network saying, does that facility have everything? Well, they're getting reports by phone. They have inspectors going in, but those inspectors are looking for very specific things. Are they really going to every patient? And with pushing, we've recruited another doctor. There was one doctor for 143 people, and I think there was 6 RNs and something like 6 RPNs. So they were successful in recruiting a few volunteers from places, but it's not sufficient. And so I think when someone said, what can we do? There has to be a tipping point. Families need to speak up. I know they're bereaved, speaking to the families is heartbreaking, but we need the tipping point of public opinion to make sure that we get back to the House and pass those legislations. And I'll leave it there because I know you have other guests. Thanks.
Thank you so much, Judith. Thank you, MPP for Thunder Bay, Atikook, and everyone who's been fighting hard for her area. And what you mentioned actually, and Dr. Viv, add if you also, what your thoughts are on this, because we are also seeing people have asked, who don't know what to do with family members who are in tender care and other homes as well. I just want to highlight one thing. And for those of you who are on Twitter, if you want to tag the minister and ask this question, the federal government has given funding for Red Cross to be at 20 different long-term care homes, emergency support. But we still don't know which homes have this support. And we're seeing a lot of for-profit homes maybe a little worried about having someone outsider come in, because then they might expose what's going on.
And turning them away, evidently.
Exactly. So which homes have gotten this support? How has that money being spent? Because we know what they do with the money. Either they waste it or they sit on it, which is the $12 billion that they're sitting on right now.
Well, and we don't just need Red Cross, right? We need military teams as well, because military teams have nurses on those teams. And we've heard from Red Cross that have been deployed into other homes that their scope of practice is very limited. They're helping to clean up, they're helping to provide trays and to feed if they can, but it's very limited what they can do, which is why it's very important that the military teams also be redeployed. We need both. We need the trifecta of the hospital rapid response teams, the Red Cross, and the military. It's not one of 3. It's not 2 of 3. We need all hands on deck. And I think anyone that's actually been in these homes or talked to the workers or heard the experiences of what's happening on the ground floor will say we need every possible set of boots on the floor helping out, because this is a crisis situation, not just at Tender Care. It's all across Ontario. This is happening, and it's just going to get worse. I predict the next month is going to be a very deadly month unless this government steps up immediately and implements key actionable items that we've been calling for.
So right now we have, and unless the numbers have increased, I get really scared now looking at the numbers, because every time I check, the numbers higher. From the last time I checked, it was 2,829 residents who have died in long-term care homes across this province. Many of these deaths were preventable. We could have saved so many lives if we took action. If we were not sitting on that $12 billion, if there are measures like staffing, we could have saved so many lives.
Yeah.
Now I want to move on to the questions, and I will try my very best to get to as many questions as possible. And Dr. Viv and I will be here to answer as many as we possibly can.
And I'm sorry that we're going over, everyone. Thanks for sticking with us.
Thank you so much. The first question I have is from Hector, who said, what would bringing in the military, the army, do to help stem the tide of infection and deaths in long-term care? Dr. Viv, you've mentioned a little bit about how that brings in immediate staffing. Is there anything else that you want to add to that?
Well, military teams differ from Red Cross in that they have nurses. So that's something we desperately need, because nurses have been in a very consistent shortage across this sector. And have been for a couple of decades now. So we absolutely need the military teams, again, supplemented by the Red Cross. And the military have been very good when they came in the first time of really implementing a regimented and standardized approach to effectively nipping these outbreaks in the bud. And not unlike the hospital teams, but again, hospital teams are overwhelmed right now with their own rises in community transmission across all local public health units. So we can't rely on them to save the day like they did in the first wave. And it's not acceptable to do that either. When we have a provincial office, we have a long-term care minister whose job it is to come up with a standardized crisis response. This is her portfolio. So why are we downloading the responsibility onto the neighboring hospitals? That's not, that is, sure, if they can assist, send those rapid response teams in, but we also need to get federal supports because we're running out of staff in Ontario. We need to get more boots on the floor. It doesn't matter in what capacity, military, Red Cross, we need them all. Get everyone in as soon as possible. We're running out of time.
And the whole situation, the way it's been crafted in the system of long-term care, and even the military and the Red Cross, it's extremely hypocritical to allow these for-profit managements to get away from the responsibility they have. Just in the middle of the pandemic, we saw so many shareholders being paid out bonuses. People made money off the backs of these seniors who died.
Lots of money. People
made millions and millions of dollars. How is that okay? How do we allow that to happen? We've got to ask ourselves, why is that okay? And why are we going back and using tax dollars to try to figure out the system when these guys should be responsible to do exactly what's needed in these homes?
Yeah. And sadly, I think we're at the stage now where if this government is not going to step up, this is the time where our prime minister has to intervene. He is the one in charge of the purse strings, so to speak. He delivers the Canada Health transfers out to the provinces. So why hasn't he set clear, tangible standards of accountability and of staffing and of basic care? This is what we need. This conversation was started. So back in September in the throne speech, he first alluded to amending the criminal code to more strictly going after these bad actors who have harmed our seniors in long-term care, if we're going to be honest. So that conversation started September and October. In mid-October, he was supposed to have been having a meeting with all the premiers to talk about national standards, and then we heard nothing about it, and the conversation stopped. That is unacceptable. Our prime minister has a responsibility now to really step up and do what needs to be done to, assign tangible standards to this funding that they are already providing to the provinces anyway, to make sure that we have higher wages for all the workers in this sector, particularly PSWs who have been consistently underpaid and undervalued. as a cost-cutting measure, quite frankly, for these big bad actors. We need the standard of care implemented right away. I mean, we could legislate that tomorrow with our premier. Or we could have our prime minister say, you have to meet this standard of care in order to get the money. We need stricter penalties.
Have a national strategy for it.
Well, I think going forward, there's no question that public nonprofit delivery is the only way to go. I mean, you look at the data doesn't lie. It's the for-profit actors that have failed the first wave, they've failed the second wave, and they failed pre-pandemic. We have data from pre-pandemic that there were more hospitalizations, higher deaths, higher rates of injuries in for-profit facilities. This is nothing new. They only failed farther, or you can say, over the course of this pandemic. So I don't think that's up for debate that it has to, any new build contracts, any new developments have to go to nonprofit, public, municipal delivery is the only way to go.
And the other thing that some of you, and I want to thank Bill who wrote to us. Hector, thank you for your question. The other thing is talking about how over the past years, especially with the previous provincial government, with Premier Wynn's government, we saw inspections completely almost eliminated. Really, it was embarrassing the amount of inspections that we had. But now, and Bill asked very actually rightfully so, said, you know, if a restaurant fails inspection, they shut down and until it's corrected. Why is an LTC, long-term care home, when they fail inspection, they're still allowed to continue to operate? And this is something actually, Bill, I asked this in the House just 2 months ago to the minister, and they failed to answer that question as well. There was nothing that the minister could give me in response.
Yeah.
Nelson also asked another question. Nelson, thank you for joining us. He said, I have a question concerning my grandma who's at tender care. She's still alive, but struggling with workers while residents are dying from COVID-19. My dad and I are worried because there is nothing we can do but pray. For Dolly, what advice can you provide us if we cannot be there for our elderly parents? Dr. Viv, what advice would you give to Nelson?
We need to let them back in. I mean, I'm not going to say that a Skype meeting is sufficient or a phone call. Nobody is going to think that that is sufficient. We need to allow and make sure that we maintain this access for essential family caregivers to enter the homes. And we just cannot keep locking down these facilities. We have guidelines that are supposed to enable a persistent access to these homes, irrespective of outbreak status. So why are we seeing homes like Tender Care violating these directives? And we heard in Minister Fullerton in her lovely CP24 interview about how family are so important and they provide this essential care. Well, yes, they do if you let them in.
Yeah.
So we need to make sure that we are holding these homes accountable when they are violating, you know, basic decency measures to maintain access, and furthermore to help reduce their burden, because family step in and they help. They assist with feeding, they assist with that cognitive care. You know, it's so important with the majority of long-term care residents who have some form of dementia to have that cognitive stimulation. And who do you think provides that? It's family, it's sharing stories, it's talking, it's remembering, rehashing memories. That is critical for preventing the deterioration of these loved ones in these facilities. The staff do not have time to sit there and talk about their past stories and their, you know, their life course histories. This is not what's happening in these facilities. It's family that does that. It's the close friends, the chosen family or genetic family. We have to make sure that we are getting family back in, plain and simple.
Yeah. And when the minister comes on camera and says they have been doing everything, my question is, if you have had all those measures, then how do people who are isolated, who have enough staff, who have enough care, how do they catch COVID? How are they you know, dehydrated? How are they calling 911 to get water? I mean, how can you, like, it's deceitful. And
well, this is what families think, right? This is the problem, is families don't think that they're being told exactly what's going on, right? They think they're being told what will comfort them, but based on what they're hearing and not being able to get in touch with the home, and they rightly feel as though maybe they're being deceived.
Yeah.
There's just a lack of transparency.
Nelson, thank you. I know you're worried about your grandma, and we'll continue to fight. We're going to continue to ask the minister to step up and provide the support that all the residents at Tender Care need, as well as allowing you and your dad to be able to have access to your grandma. I also have Robin who asked, who said it is insane that in the 20th century we have to fight lawsuits, bills to be able to be with family. Family is the fundamental unit of society per the Universal Declaration of Human Rights. Please don't investigate deaths at long-term care homes. Ask yourselves why. Answer government. And I hear you. I hear the frustration. I want to go to David Chang's comments, who David wrote, I'm not convinced that long-term care homes are the only way to go for older adults either. Long-term care homes should be seen as the last resort. They are. We should explore a publicly run home care service post-COVID-19. I agree 100%, David. He also goes on to say, other adults maintain independence, a better quality of life, and are happier. It's also a lot cheaper than what governments currently spend on geriatric care. Long-term care should only be considered when it's no longer safe to independently live at home. I 100% agree. Go ahead, Dr. Viv.
Well, I mean, we could learn a lot from the Netherlands here that, first of all, 90% of the care is publicly administered, but when they do have long-term care, it is in small houses, effectively, that house about 6 to 8 residents, and have a communal living room and dining room, but they also have their own, their own outdoor space, and that's important. These are all like, single level facilities. This is the kind of model we need to move towards, right? Smaller scale, home care for people who can receive home care, but there's always invariably going to be a proportion of the population that either doesn't have family nearby, is not able to get enough supports, or needs such a high level of support that they need 24-hour care. And we're going to need to make sure that we don't just abandon this ability to fix the long-term care homes we have right now and say, oh, we'll just focus on home care. No, because there's always going to be some people who need institutionalized care. Can we adjust the form that takes? Absolutely. Can we move to a model, indicative of the Netherlands? Absolutely. So, but unfortunately, what we have seen right now is that our government is actually building more warehouse style beds. And we have heard the Ford government released in July that they are going to do just that, build more warehouses. And this is not what people want. And this is not what is really talked about in the literature as the way forward. So I think this government really needs to pay attention to the literature, get the experts on board who actually know what they're talking about when it comes to long-term care. People like Pat Armstrong, Tamara Daly, really getting in the right people to help make these decisions and to help really design what institutional and home care will look like going forward.
And you're absolutely right. The reality, and the anguish that people are facing, the loss that we have faced in these homes. If the government wanted to act now, they could have spent the $12 billion and done what was necessary so that we are not facing outbreaks in 207 homes. So just to let you all know, we're facing outbreaks in 207 homes right now across the province. I also, I talked about before that we have over 2,800 residents who have died from COVID-19. But and this goes beyond any party politics, but the Ontario NDP has actually highlighted a lot of the specific solutions that we have come forward with after talking to many family members, many experts, like Pat Armstrong, for example, that Dr. Viv was just talking about, who have talked about specific things that we need. And one of them is getting rid of for-profit care. Care should not be about for-profit. And the platform that we released, I will make sure that I add that to our comments on our feeds on all 3 platforms. But it really talks about how can we really overhaul this whole sector with proper staffing, with small home-like long-term care communities. This is someone's life, this is actually someone's home. If you look at a long-term care building, it looks like a hospital. It looks like an institution that we're basically caging people in. And I'm sorry to say that that's how it feels like sometimes. So if we have care about profit, that's what it ends up happening. We have to make sure that care is about care. It's about the human life. It's about the loved ones who are living in these places. So having something that's home-like, that's a community. And Dr. Viv talked about the Netherlands example, which is a great example for making sure that we're providing care, not profit services to these to our loved ones. It just boggles my mind how the solutions are there, and we could have done so much more before, and even during the pandemic. And if the crisis doesn't get this government to act, I worry, Dr. Viv, if we're actually going to do anything post-pandemic.
Well, I'll keep fighting until change happens. That's for damn sure.
We have to.
I won't go down quietly.
We have to keep going. I have Joyce, Amanda, and Ingrid who messaged. Joyce said, what we need is for people to think differently. We need quality, reliable, easily accessible home care, which includes support for the family trying to keep their loved ones home. 1.6 ratio of home care to long-term care needs to shift to 6.1 home care to long-term care. I completely agree. And she goes on to say, unfortunately, the funding is allocated to a bed, not a person. Well, that's because, honestly, and thank you, Joyce, honestly, when I hear the government talk about long-term care, they talk about numbers. When they talk about debts, which, by the way, not the ministers want to highlight debts. They don't want to talk about the numbers. I know Dr. Viv always goes and reminds them about how many deaths there have been. That's because to them, these are numbers. I have Amanda, who also wrote, staff need to be qualified staff. Ford government is hiring staff that are not qualified, no education, no experience, just extra bodies that take away time from qualified, educated, experienced workers with the residents. Part-time staff in long-term care need to be given full-time hours. Then let's see how many staff hires are needed.
Absolutely. Yeah, we need to move to full-time permanent staff. And we need to properly enumerate this work that is very difficult work, but it's gendered and therefore, unfortunately, enumerated less than it should be. And we need to, I completely agree, we're moving in the wrong direction with hiring, unemployed and displaced retail and hospitality service workers who might have their heart in the right place, but we need skilled healthcare workers. And RNO, the Registered Nurses Association of Ontario, Doris Grinspun has been very clear about this. We have nurses, there's nurses out there, we just have to hire them. They're there. So why can't you hire them? You can, you just don't want to spend the money to hire them. So instead, you create this resident care categorization so you can further race to the bottom and continually de-skill this labor. And when you de-skill this labor, it has real consequences for residents, right? There's a reason why there has been such a drastic increase in staff to resident abuse, whether it's an inadvertent or not, that's not the point. The point is there is an increase of abuse in these homes. And a lot of that is because people are rushing to provide care, and then you're not providing proper care because you're put in a position where you're designed to fail. Right? So I'm not trying to blame the workers here. It's the fact that this kind of staffing strategy has been put in place, which does not afford them the time to do their work and to do their work properly, right? So this is a larger systemic issue that has to be dealt with. One easy way you can deal with that is by passing the time to care legislation, which will bring up the legislated or the care standard, the 4 hours a day right now. Not in 4 to 5 years, which does nothing to help residents right now alive in these facilities, but legislate it right now. There is no reason why you can't.
I want to just add on a few more of the questions that we have received, and then we're going to try to wrap up. I know we have gone a little bit over time. Dr. Viv, thank you so much for giving us the time this evening. And thank you to all of you who have joined. I know you have so many concerns and comments. If we can't get to any questions today, please do write to us and we'll make sure that we email you back the response or share your concerns with the ministry. I have Ingrid who wrote to us and said, thank you for hosting the town hall. The situation is beyond sad, it's criminal. Please share what you can to help us make our voices heard through petitions, letters. The election is too far away, so we need to act now. Naomi wrote down what responsibility do the nursing staff, their unions and family members take to have allowed these tragedies to happen. I think that we have to really hone in to the issues that we have limited amount of people in these homes, and we have really, like Dr. Viv was saying, we have set them up for failures. We should have done better to provide the care that people need. We also have Michelle, who wrote, this process will cut out the deadlock BS in the legislature and get on with the business of caring for these poor seniors. It's time to work directly with the federal government. When you start removing powers from the Ford government, you'll see how quickly crap gets done. Pardon my language. I agree with you. Jamie wrote, thanking all of us. Vinod also said how the people interacting with the Ontario Long-Term Care Commission to intervene. And Dr. Viv, I know you mentioned about the Long-Term Care Commissioner and how they have highlighted some of these problems and proposed solutions as well.
The solutions are there. This is not a secret. The Minister of Long-Term Care knows what she needs to do. It has been very clearly outlined for her in both, not one, but two interim reports. Things like instituting independent infection prevention and control managers at each home, which Quebec has been doing successfully for months now. There's a reason why you're not hearing about this devastation in Quebec as you are in Ontario, because they have done things like engage in a targeted staffing blitz, which we didn't do. I would love to know if the government could provide us an answer on how many actual staff they've hired over the course of this pandemic through their accelerated training programs and the return to service program, which was also simultaneously offensive to existing staff. I can get into that and have gone into that in other interviews. But the point is, staffing blitz, absolutely critical. We've been calling for that for months. Infection prevention and control teams, managers at each home. And then because we are in a crisis, because we waited too long to do the things that we needed to do, like those first two things, now we have to rely on the federal supports. We need the military, we need the Red Cross, and they will supplement the hospital rapid response teams that are inevitably going in to try to save the day because our government failed to do what was needed to do over the preceding 10 months.
Yeah, and I want to go back to actually Naomi and wrote, were they afraid to complain frequently, since she's talking about staff and family members? Were
100%.
To ministry or news reporters for fear of losing their jobs, and were family members afraid there would be repercussions on their residence by staff and management? In 2012, when I visited this home, the common areas used to smell of urine and supposedly still do.
This is the biggest problem, is that, I mean, these problems go back, this is nothing new, but the fact that we have had reports that some homes, probably more than some, have actually told the staff, if you speak, we could get one word of you speaking out, being public about this, whatever's happening in our homes, you're fired, that's it. So of course they're terrified. You cannot rely on staff to be whistleblowers. That's why family are so important. But at the same time, family tend to only speak up after, unfortunately, their loved one has passed, because, and I completely understand why they're doing this, because they are afraid that their loved one is in this confined space. And what if they are blocked from access? And what happens when they're not there for the maybe 1 or 2 hours of, week that they're getting as essential caregivers? So of course they're scared to come forward. That makes perfect sense. We know the problems. We've heard, whistleblowers from other, usually what happens is, and what happened in tender care is that when the external staff are sent in, like a couple hospital workers that were sent in as an emergency resource in mid-December, they're the ones that whistleblow. And that's how we got tender care out into the media and effectively got more help sent in. But it shouldn't, that should not be how things are happening, right? We should have a standardized system in place that when a home enters outbreak, they can trigger the crisis response and then get help sent in. I mean, this should have been something that was put in place months ago. But instead now it gets to the point where the outbreak is so bad that a lot of these homes don't want to speak up, because they don't want the public to know how badly they failed again, right? There's a lot of fear by a lot of these bad actors in drawing more attention to themselves. So unfortunately, instead of reaching out for help, and even we just heard it in the case not too long ago, that some of them are overtly turning away help because they don't want independent individuals in seeing what's happening. I mean, come on. Is this seriously what we're allowing in Canada, in our province? This is ridiculous.
Yeah.
Do better.
I want to take a moment to thank people like Naomi and many other advocates, many family members, and many experts who have gone above and beyond and risked themselves in so many ways to highlight what's happening. The work that you have been doing for so many years now, it's incredible, and I, from the bottom of my heart, I just want to say thank you, because you have been the voice of many of these residents. You have been highlighting this crisis and working hard every single for so many different ministries, different ministers have come and gone by, and you have been doing the work, and we need to be able to make sure that the things that you're asking for gets done. I have so many messages and comments. Edward, Robin, Christine, Brad, Joanne, David, thank you so much to all of you who have joined. We are running out of time. We have gone way beyond our time that we've allocated today. So what we're going to do is we're going to make sure that we respond to you via email or in our comments and wrap up here today. But there's one story that I do want to wrap up with, which is from Stella, who wrote down, "My dad was at Hawthorne after his Alzheimer's became worse. My sister and I used to visit him daily with home-cooked food, and what I witnessed there was horrible. Understaffing, mismanagement, seniors' diapers not being changed, etc., etc. These seniors' homes need to be changed to not-for-profit, and the province should take over all of them. The shareholders are becoming rich and richer at the expense of our loved ones, and this is totally unacceptable." I know this is the sentiments for so many of you, and I thank you all for sharing these stories, and I will try my very best to respond to all of you via email or comments, and I promise you that I will share these concerns with the minister. What we have heard today, it will go to the minister. So thank you so much. Thank you, Dr. Viv. You have been so incredible. I can't thank you enough for what you have been doing. You've been truly a voice for so many of these families, so many of the residents. It's been tough listening to some of these stories. It's also been really frustrating listening to the minister and her spokespeople who have come on through statements and on TV and really kind of ridiculed this fight and ridiculed the struggles of the family members. Yeah. So I want to wrap up for today, and I want to hand it over to Dr. Viv to give some closing remarks and say thank you to you.
Well, thank you as well. It means a lot that you wanted to engage in this town hall, and thanks to all the families. I know I've spoken to a few of you who either called in or just have been talking to other media. What you're doing is making a difference, and we support you, even if you feel like you're unsupported, maybe by the home. You have a support base in us, and we're going to keep fighting. We're going to keep doing what we have to do, and pleading for national standards, taking this to the federal level, while also demanding that at the provincial level, that proper change, immediate crisis change is put into place. And that's all I can say, is that we're just going to keep doing what we're doing. And thanks for sharing your story, and everyone just being really helpful and really supportive.
Thank you, everyone. Thank you for tuning in. We'll be back again. We'll do more of the town halls that we continue to do. What I'm going to do now, our next steps will be to really put everything together and send that off to the minister. We did invite her to join this town hall. Unfortunately, she did not, but we'll make sure that she gets to hear what you have shared today. And we're going to ask her to do her job. And if she's not able to do that, maybe she should step down from this ministry and make sure that people get the justice that they deserve, right? Thank you to all of you across different platforms, and thank you, Maisha, and my whole team, Kashfi, Stefan, Christina, all of you for doing everything you did today.